I would like to call the meeting to order, please. We do have a quorum. There's Mr. Avispa, I'm still waiting on Polly, but we have a quorum, sorry. I told her to come in anyway. We need the approval of the minutes for the last meeting. Has everyone read them? They were sent to us by email. Is there anything you need to change? There is one grammatical error, English teacher, that I saw where it says we need to present a statute when it would be a statute.
Yes.
And other than that, they look fine to me.
I second that.
Okay, call for the question, all in favor of approving the minutes? Anyone opposed? Motion passes. That takes silences to agreement. All right, public comments, anyone? No, we had some right now, and so I recommend a proposal and send it in to Dr. Gonzalez, saying this is what we have, this is what's around, and this is how we would like to be involved, and then we can all meet at the table.
Yeah.
¿Verdad?
Yeah, definitely, and we invite you all to go and look at the facilities. You know, these are Webb County's facilities.
like to
that,
go as a
yeah,
group.
and
Someday.
We have 4 facilities because we also have an adolescent facility for adolescents 12 through 17 for boys. We have 16 beds and we have 8 beds for adolescent females.
Okay.
so we'll be happy to show you.
All right, and yes, we would like all those stats, all that information, you know, that we can, and then propose to see how we can work this all out, because the less money they have, the less money they're gonna give us. All right, we decided that for the next meeting, we need to have some sort of contact with a higher up county official. The judge is fine, he came and presented what he had, but now maybe, you and I as chair and vice chair can go visit, Judge Tijerina and, his money man, whether it's Leroy or Uribe, I think it's Uribe, to talk about this and what we bring to the table. And that could fall into very well with what he just started with the suicide thing, that his cousin, and that he was upset because they had grown up together and she committed suicide. Many times it could be that she needed a place to go. Counseling, or I don't know. Anyway, we go on to, and we can sort of bring that up. We will then, I'll contact Dr. Gonzalez. And then you can please talk to, of course. And we'll try to set that up so that he can go with you and me. Hopefully, because he's out of town a lot for review, they send him everywhere. We need to review the updated directory, the judge, everybody's a judge today, I'm sorry, the Chief Torres brought in, you put it all on paper. Did anyone not look at it, not glance at it, any of the board members on the, in the email that we have?
Nonetheless, the Substance Abuse Services Provider Directory 2019 is already bound here, and Dr. Gonzalez has it also in her office. It's on the email format. Anything else that would need to be added or deleted is going to be available, but the public needs to know about this too. So we'll network how we're going to release it, or
Right.
we're going to network how we're going to best use it. But before we go forward, I would like to everybody sign in the sign sheet out there and do the intros, introduce themselves to the rest of the board here in the committee as we move forward. If anybody's going to speak, start with your name and represent, and who are you representing, and then, say your piece. That is, of course, and we follow the public comment format, which is we try to keep it to 3 minutes, but nonetheless, Chairwoman here is the one that runs the meeting here. Needs to do the Q&A or follow through with question and answers. We'll go through, notes will be taken, and then of course at the end of the meeting before we adjourn, we check off where we need to follow through in any projects that we need to move forward. If for everybody's knowledge, the semi-annual report was already delivered by Dr. Gonzalez to the City Council last meeting. and it was accompanied by a letter signed by the committee members and the chairman here, the chairwoman, and also copies of every agenda, every report, and everything, and every minutes of every meeting that we get. This is meeting number 8, this is month number 8 of this commission. And, you know, probably we have only missed one for lack of quorum, so we just continue. So,
Alright, so then we have this already bound, and we're also putting it out on, Facebook, social media, trying to spread the word as much as possible, because obviously, from looking at this, there are a lot of programs out there, and many times one doesn't know about the other, or the people who need it don't know.
I didn't know.
Yes, so then, and she's been dealing with it for how many years? Okay, so then, it's obvious that there is a lack of communication for the public in town, in the community. Yes, sir.
My name is Luis Flores with SCAN. Just another commercial. We were notified that we got a grant from the Center for Mental Health Services to provide mental health and substance abuse disorder treatment for homeless populations. So it's a 5-year grant, and most likely Dr. Cuellar is going to announce it pretty soon. It begins October the 1st, so then I wonder if we can add something to
Yes.
the directory, so then we can inform them about this program and the other offender reentry programs that we have.
Yes.
And I don't know if I'm missing any other programs.
The adult peer recovery
Oh,
program.
yes, we have an adult peer recovery program.
How many beds?
Well, it's just, this is,
Outpatient.
people that are in recovery that help other people that are, struggling with, staying clean. So there's a peer-to-peer. kind of-
Support.
Yes,
Mhm.
so these are the recovery coaches, people that have gone through, the experience of, using drugs, and now they have recovered for a while, and they would help others. So we have a facility where they can do that, you know, and you can explain more what they do there. And, like a resume and, if you-
My name is Dr. Christopher Craddock, from the Vice President of SCAN. We actually have 2. We have a youth peer recovery support services program, peer-to-peer based, and we also have an adult program that we just received funding for from the state. The idea is focusing a lot on emotional support services, affiliation activities, but having mentoring, one-to-one people that have gone through that process of addiction, recovered, provide a lot of valuable insight to people that are going through that problem at the time. And we know that there's not, just one path to recovery. So the idea is, a lot of people are familiar with 12-step programs, and this is very different than that. We incorporate that as part of it, but we also want to make it very individualized on what the individuals need that they feel in their lives in order to recover.
Like you teach them skills,
You
life
do-
skills?
There's life skills, there's a lot of affiliation activities, bonding in a healthy manner without alcohol or drugs being involved at all. A lot of people think that that's the only way you can have a party and have fun, and so we really work on that aspect of it. A lot of life skills, but more than anything, a big focus is that mentoring, taking people one-on-one, having the time to talk with each other, to work on issues that can help them, achieve recovery.
And so how do you follow, let's say my daughter's in Henderson, Texas, and she'll be back in 6 months, and now I would like for her to go to a transition. Well, what does she need to
Well,
do?
they would need to just show up at the facility or contact us. Call us, either way. We have it on our website, but they would come in, there would be a brief screening process, and we would develop an individualized plan for the people. There's a big focus on individualized, it's not one cookie cutter type situation. We know it's very different for each individual. And some people have preferences in terms of what type of mentor or peer recovery coach they want. Some want male only, some people want a female. So we try to work with what we can based on our employees.
But it's not like the transition living where you live
No.
there and you
No.
teach them skills and you take them to work and you bring them back so they get structure.
The facilities it varies in terms of the hours, it's based on what the clients want. Our youth facility right now is pretty much there from about, 11 o'clock to 7 o'clock at night. So we're able, if you kind of think of a drop-in situation in a way, it's a place for them to go, so they don't get in trouble in the community after school. They can go and they can watch video games, get education lessons, we have a pool table, we have popcorn machines, we have nacho cheese machines, we have a lot of things there to keep them entertained, but to also provide them with a lot of education and support
Great.
in what they're doing.
Luis Flores from SCAN again. I guess you're thinking more like a supportive residential, is that what you're looking at?
Right, so that they could learn skills and, you know.
So to stay there, you're looking for.
Right, because I believe that they still need to, you know, have more transition type of living before they get out into society.
So if you have somebody like that went already to an intensive residential phase, and then they come into Laredo, there's a possibility we can link them to supportive residential services here. We do have the residential program. And they receive less hours of therapy, but they go work and they come back, and so we have that.
But there's places that take them to and back and, you know, so this isn't like that. They would have to get
Oh, okay.
themselves back and forth, and that's a problem that a lot of them have. They don't have a license, they can't drive. So that's the thing that we're trying to connect the dots for. How do you get them to and from so that they don't have an excuse that I don't have a car?
And one of the things that we do with people that have co-occurring disorders, we have a program called co-occurring psychiatric and substance use disorders. We provide that intensive case management, but they need to have co-occurring disorders. Meaning besides the substance use disorder, they must have depression,
Mental
anxiety.
illness,
Yes.
it's usually a dual diagnosis.
Exactly, yeah. And then for those, yes, we do. We
You
provide a lot of transportation,
Oh,
yes,
okay.
yes.
Okay.
Interesting, wonderful.
Thank you, yes. We will have all of this written up in our notes, and we need to get our heads together around everything that's being offered.
Right, because she's with 52 other girls over there. 52 other people learning new things over there.
Okay,
Good things.
Yeah.
then, thank you, and we will continue with this so that we can meet our timeline. We need to review the updated directory that Mr. Ariza sent in.
Yes,
Do you have it online yet, right?
Or it's up here, no?
that's not it.
No.
I don't believe, I had sent it to Dr. Gonzalez and to his administrative assistant
And it's in one of the binders, is it not?
last meeting.
Oh, that was the
Yeah,
last.
and that PowerPoint that you sent,
That PowerPoint is just basically back in 2013 when Wesker came to the table to take over the program that we now have which is Next Step. And there was a presentation at the City Hall with regards to the Community Triage Center, which is what we're all talking about right now. It's just something that was presented back then. Just thought maybe we just bring it to the forefront, but it's not like for this discussion for.
It's not relevant today?
I'm sorry?
It's not relevant today for this?
Not really.
Okay.
Okay, and the updated directory was emailed to everybody. So, and we can add to it. And then we need to publish it in social media, Facebook, wherever we can, posters, at the jails, at the detention centers,
The
everywhere.
prosecutors.
Can I see a copy? Is this what was sent to us today? I didn't really get a chance to.
No, what
No,
we
it's
sent
the
to you
other
all
No,
today.
that's the
So
one
this
that was provided by Dr. Gonzalez and compiled by the intern.
Oh, this is the directory.
Yeah,
That's the 2019.
that's the directory.
That's the
So
local.
whatever you sent today.
Yeah, whatever
What you
last
said
minute,
was
it's not
the
even
area.
It's not even on paper format today.
That's just
That's
like
kind of what they-
Was
I-
it sent today?
What I sent him today was a separate resource directory that I Googled
Oh, so this is
Online.
different.
on South Texas area projects that have rehab and detox. And I didn't include the Laredo locals because we already had that on this.
On the
this
southern
directory.
directory, right.
So I just wanted to make that clear,
Mm-hmm.
that I was not intentionally leaving out anybody,
Mm-mm.
because we had already done that initially when we had this
Right.
this
They're
project.
already in this book.
They're already in this
Yeah.
book.
Mhm.
Now, if they're not in here, it's because they didn't, when my 3 interns that I had contacted each agency, there was a point of contact that Dr. Gonzalez had given them, and they went, each one individually with all the different programs, touched base with all of them, had this updated, and then put this into this format, right? Which is an easy format for anybody to make modifications.
Mhm.
We even made modifications up until this last meeting of like 2 days before, because we had some other entries that were submitted by Water Region and also by, I think, South Texas, with, Sonia Lara. So those entries were made at the last meeting. So this directory is that compiled.
As up to date as it could be,
As it
because
could
the
be.
interns,
There was also mention of
Are
the
gone.
name change, because it had youth, and we were gonna talk about making it families or adults or whatever.
Right.
So I don't know if that was made or not, because those are the,
Well, this original one, was scanned, it is scanned, Scan has
it's
compiled
scanned,
the information, so they
Yes.
do specify it for youth, but, I think that's why it still has the Webb County Community
Exactly.
Coalition, and it also has the name youth to it. But I mean, if it's gonna be the Drug and Alcohol Commission, I think it should have the Drug and
Yeah,
Alcohol
you cover.
Commission,
yeah.
name on it,
all we did was follow
logo.
the protocol that was given to us, or to me, to give to my interns, and so that we use that same format. So,
And the interns did a wonderful job.
thank you,
They did a wonderful job.
yeah.
And I'm sure they're going back to college and we're losing them.
Yes, well, they already obtained their masters.
Yeah.
Well, some of them are going for their masters now.
That's wonderful. Okay, well, thank you for that update. We go on to strategy for next steps to develop a local detox center. We have to get, again, together with Dr. Gonzalez sometime, maybe next month. We haven't seen him in 2 months. He's been out of town. And, then draw in, we need a bigger room to draw in everybody that would have a stake in this, all the stakeholders, as he says. And, work it out together. We can save money by,
Integrating.
yes, we can save money by integrating everyone who's here and available and offering and,
The next meeting, we can use our auditorium. It fits up
Okay.
to 300 people, so everybody would be able to fit there
that
comfortably
would
to
be
have those
wonderful.
discussions.
Yes, that would be wonderful. Bring that one up to him too.
Of course.
Auditorium. I'll remember, all I have to do is write one name, or one word. And I remember. Okay. Then that would be the strategy for next time, bring them all together and make sure, I don't wanna have that meeting without him here. If he's gonna be out of town,
We'll
Rob.
schedule them.
yes,
Makes
reschedule.
sense.
And then he talked about all those other people that he had wanted to come in, but they might have had short notice on this, and so we need to make sure that they can be available. And we need to do our work. We need to go beforehand and talk to, say, the county judge and so on and so forth. And then go to the city and talk to them behind the scenes. And then let them come to the table. Don't let them, if they're like our school board, and I used to work for LISD for many years, 42 years. If they're like the school board, they don't want you to show up and say, oh, I have something to say, and it's in the initial 3 minutes that they give you. They don't like surprises. You have to talk to them ahead of time, tell them what it is that they are going to listen to, and then it's okay. So this is what we need to do our homework. And so we need to talk to Dr. Gonzalez about that.
Mrs. Quintanilla, if I may,
Yes.
suggest for the strategy meeting, could we possibly do it, on another date other than our meeting date?
Yes,
That way we are able to have ample time to just discuss the actual planning of it. I know many years ago, I think when, it was originally planned, I was part of that group too. I think it was like a lunch meeting and it was like 2-3 hours, it was like an afternoon. And it just was coming in and out, people, the stakeholders having to, say what they thought, and then just the core having to stay and just plan
Yes.
fully. It may not need to lead to 3 hours or anything like that, but just maybe an hour and a half or something, where it's just particularly just that
one
topic to
afternoon.
tackle, yeah.
That's a very good suggestion. Yes.
And everybody remember, we got short-term and long-term goals, so one of those that we're speaking today might be one of those long-term goals where the center rehab and everything else is getting a yes from the stakeholders, not only city government, county government. Because that's the number one priority that we've spoken about in the first few meetings. Short-term goals is, projects and programs that do exist they can impact positively our community, advertise that they do exist, and not just depend on, somebody else figuring out with third parties or drug court programs. They capture those patients when they get arrested, then, they go through the program.
We need that social media really big.
Yeah.
Exactly, that was one of those goals too, that just keep people, keeping track with those, so we can move on with the program.
Okay. That's
If I-
Manuel and being recorded, we'll keep.
I'm actually sending Dr. Gonzalez that information via text.
Great.
If I may, I also have a new intern right now, she's going on her
There you go.
master's in social work. So she'll be also assisting us with any other needed research that we might need as a team.
That's wonderful.
So she'll be with us
Absolutely.
till, December, right?
Oh,
Oh, May,
a whole year, even better.
good.
Well, what's left, right, of this year and the next, that's good. I'm talking about school year, to me, I'm still school year, I'm sorry. That's the way I work. Okay, thank you. And, any staff and stakeholder updates besides what we've already heard about?
Well, they just, the description of the report to the council. And it is thick, it's, what we attach to everything is, all the agendas and proposals, goals and everything else from this committee to council for them to look over and actually move on. Dr. Gonzalez, I mentioned that he was personally present that to council. I don't know if it didn't happen or not, but we need the feedback on it so we can move forward. The number one goal that was actually is inventory local services. We've done already that. And then we move forward with the prevention and outreach programs to the schools. And
Right.
Remember, we talked about the youth and prevention programs. So, that's one of those things that we need to set our heads together and move forward with to invite LIZ, USZ reps. 3 meetings ago, we talked about that. We're supposed to do that. Nonetheless, some other presentations get in the way, and then we push those aside into later meetings. So what we can do is, if the next meeting is the stakeholders meeting at that 300 capacity auditorium, we actually need to move with the school districts so it can be joining this committee.
I think we need to go through the counseling department, because the
Yeah.
counselors
Yeah.
are the ones that,
The school district, they have their people out there that can come in and hear us out. But, anything else is included today to jot down what is it, the next step, basically, and I already said a couple of those. So next meeting, and of course, our meetings are monthly basis, so.
oh yes, it's a good idea, what Colleen suggested, Ms. Rodriguez, about, having a special, different day
Yeah.
to meet in that auditorium with all these people and be prepared to
Yes.
stay, even if it's sack lunch or box lunch or, nothing exciting. Not
Or bring your own
expensive.
lunch.
Or bring your own lunch, BYO.
Brown bag it.
Yes,
Well, that is a great idea, I think, because the committee meetings are here on a monthly basis, If we're gonna invite stakeholders, everybody needs to be educated that we do exist. We already have an inventory and just bring everybody on board and be a renewed and fresh, out of the water type of program.
right.
To continue, reducing the use and abuse of substances in the city.
And bring together and integrate all of our different great offers that all these different places have. It's just a matter of, I was totally in the dark about half of it.
Me too.
I was totally in the dark. So this is very good. We're coming together. All of them have been coming by to visit and present and so on and so forth. So I think we're doing a wonderful thing for our community as a
Yes.
whole, all of us.
It's needed, it doesn't exist.
Well, I gotta say this, I reviewed the agendas from the last committee back in 2003. And of course, I saw that there was usually non-quorum meetings.
Oh,
You see what I'm saying? So, I'm proud to say that after 7 meetings, this is number 8, what we've done so far with the full report to City Council. You know, it's just one of those things we have solid, solid move and positive steps. And the health department and the police department has been as facilitators for this committee. Nonetheless, it is our job to continue with you as representatives from the council to move forward, because we've seen it in a national landscape. And we don't wanna be one of those cities that has, the issue on the streets where we're gonna be scraping out people from sidewalks and on the bridges and all that. We do have a problem, we exist and we have recognized that, but having stakeholders here present, most meetings are here present because they are interested in helping out. So this is a very positive move nonetheless.
That we can connect the dots and get them all on one
Yes.
place.
And Mr. Rodriguez, and by you, asking the council, the county sheriff's office to be involved with this, and I did contact them. They do have those programs. The only thing they need to know is whenever we're ready, go over there and push that program. And they're waiting for
Okay.
the DWI program. We're still waiting for that one, and then the other one is.
We're waiting, I
we
guess,
have
for
any
some
issues.
background checks. My husband has his, but
Okay.
some of the people, they say they're going to
Yes,
go.
that's another population there. We actually have decided to capture, and they come to the county jail with a DWI charge, either, alcoholics or branded as abuse of alcohol. That's one other population we're going to do, so.
Mhm.
It is drug and alcohol commission.
Yes,
Right.
exactly.
Madam Chair, regarding C on our list of discussion here, the strategy for the next step in developing the local detox center. I was curious, you mentioned that you wanted to get the ball formally rolling after the elections because you didn't want it to fall apart like it did last time. And I was curious, wouldn't it be prudent if we took a few additional steps? I'm thinking, one, we need a meeting where we talk about the location with the county, I guess, because that's the location that's apparent, that's obvious, I guess, and that seems like it's a no-brainer there. Number
Okay.
two, I would like to hear from WestCare to hear what their proposal is before we go into any type of roundtable with other potential investors, I guess. And
Okay.
number three, I'd like to hear from the old director of that detox center,
Who is Jesse?
Jesse Hernandez, I believe.
Yes.
See how it was run, what was going on. And next, I would like to make sure that there are no, maybe, for lack of a better word, I'm gonna say counter offers or counter providers for this program. WestCare, I'm sure it's a great thing, and I know
Yeah,
Michelle
no,
spoke,
By no means I'm saying that Westcare is gonna take this project fully. I mean, we're
It's a
at the
big
table
project.
because we wanna be part of this community. We wanna help. We would invite anybody that would like to put in their proposal. And,
Well,
The
yeah,
merrier.
the
We
more
would
the
like
better.
that opportunity
Sure.
to do that,
Yeah.
because we took, thinking about a facility, in our male resident facility, we have extra beds right now that we cannot use.
Right.
So then it may be something that we don't have to, if we could cut in expenditures and look at whatever
Right,
we already
that's-
have, and then see if we can talk, because if you strengthen our program, then, you strengthen a community-based agency that has been there doing it for a while.
And that's my goal. Let's not double spend.
Right.
What's already there, let's take theirs and join with the other ones and whatever everyone brings to the table.
Yeah.
And we don't have to spend as much money.
And Isela Dapto, I'm the CEO for SCAN. On what you all were talking about is that facility on Juarez. We had looked at that facility before, and you have to realize that in order to do detox, you have to get licensed by the Health and Human Service Commission. And that facility needs a lot of work to do that. You can't have a lock
No?
detox facility
No.
unless it is being done by a jail or a prison. So it would involve windows, changing doors. It's
I
a
see.
very different schematic because I've
From what?
already
She
done
was a
that.
juvenile probation officer.
I'm very familiar with the facility. I worked in that facility for many years.
See, well, obviously through Judge Hale, he's the one who had recommended the
Yes.
place. He's not aware of What you can do.
You have to be licensed.
Mhm.
Actually, SCAN was the one, Jesse was an employee of SCAN at that time when he ran, the Raíces detox facility for us. So if you need any information on that, actually, we're the ones that
You
have
have it.
and the reason that we had to stop providing the service. And the same thing, I can tell you, AMA, the Association for the Advancement of Mexican Americans, ran a detox here in Laredo, and they also had to stop providing services. Both of us had to not do detox because the way the state funds detox is on a fee for service. So it's a unit rate. So if you have an empty bed, you're not getting paid. And we would both struggle, AMA would struggle, SCAN would struggle to keep the beds full. Right now, we have Charlie's Place in Corpus. They do detox for male and females, and they are struggling.
But then we-
Okay,
the-
the reason, I think, I'm sorry if but I've had, my daughter was 16 and now she's 24. She left Charlie's Place. If they're not locked down, they'll leave.
Yeah,
Well, you have to realize that the state of Texas looks at things
Yeah.
in a certain,
That's the-
in a
that's
different way, you know, we
The
can all say yes, lock down in our facilities too, we would love to say, you know, we could lock them in and keep them, but there's very specific licenses that
And
are
there's a
allowed
bill,
in the
yeah.
state for lockdown facilities.
And
Well,
the
then
plans
we
have a
need the
bill-
people to get those,
Yeah.
because if we just talk about them and say, oh, they're only in Henderson, and they're only somewhere else, and we just say, like, it's impossible for Laredo to get them, then we never try. So we need to find the way to try, because otherwise,
Mhm.
they will leave. I have experience with my
Yeah.
daughter leaving 5 of them.
And most of the time, they're not allowed in the state, lockdown facilities.
I think there's only you
because
commit, I don't know.
they would have to be done through court commitments, because this, you know, people as well as, you know, young adults and adults, you know, there's freedom of choice.
Yeah.
And that is the problem, and, you know, we would love to work with everybody, but it's, you know, we can't force them to stay in treatment if they're not ready
the law.
to be in treatment.
Exactly, and then actually we have to read the Bill of Rights, and that's included, that we cannot hold them.
Right,
over,
like
you
she
know.
was in lockdown in Uvalde, and they took her to work, and they brought her back, they got her back on schedule and all
But
that.
those are run by jails, they're, private corporations, so
It's a
they're
private
doing like
corporation.
jails, yeah. They get a
It might
very,
be like a psychiatric.
Yeah.
I don't-
they
yeah.
get very,
This is Yvette Lopez from West Care and also Board Region. So I think that, the grant that you all got, I think that would be a great idea, maybe like the support, like building the foundation of a strong support, and adding like the sort of community treatment or like the intensive with team approach, which I also do
Yeah.
as well. I think with that, that's how recovery is possible.
Yeah, and I think that that's one of the really things that you brought up, and what you brought up, how do we, the little pieces that we have, how do we make them fit?
Right.
And then strengthen the infrastructure that we have. Cause
yeah,
could not
and we
really-
work very closely with the criminal justice systems and the courts, you know. There's a lot of influence on the clientele for being on probation or being on parole, you know, to order them into the services, and, you know, they have more of a deterrent, you know, from running, and they prefer to stay because, you know, the
They're on
consequence would be, you know, they could be locked up. So I think it's more, how do we bring all the pieces to the table, and how do we
Yeah.
support each other? You know, and that includes, you know, the probation departments and child protective services and everybody, to support each other, to have the client be successful in the completion of treatment. Instead of piecemealing it, that, you know, we don't work with each other, we don't support each other.
And we don't have to work with the law. Could we change the laws? Could something be done to?
Regarding
Where-
what lockdown
Yeah,
facilities?
yeah, I mean,
Because-
having all that money,
I mean, I
and
was,
then you can't do this and that and
Right.
that.
I went as far as having judges, you know, sign so that she could be, you know,
Yeah,
committed,
committed or-
and I, you know, and so we shouldn't have to do that. I understand that you're saying that they're adults, and we all say that they're adults and everybody should have their rights, you know.
And, yeah, there probably the laws could be changed, but you're always have to keep in mind that there'll always be civil libertarian attorneys that would be ready
ACLU.
to,
But I think that,
to take it.
there may be programs also that are locked down, but I wonder if it will be even more expensive to run them, I'm imagining, number one. And the other one is that when you try to keep somebody per force, then, I don't know if you have to take them down or whatever that may be, and then the ability of that person to really buy into the treatment is a bit more difficult.
Because detox is short term, remember, an average detox is 3 days in the
Right.
state of Texas.
If they don't have 2 years of treatment at least.
And then from there they go to treatment facilities. So it would just depend, at what stage and what type of facilities, that it was wanting to
Long
provide
term.
for their community. And the cost of
Right.
providing it, cause you're talking about,
Everything comes down to cost.
That's
You
the
know.
bottom line.
Cost
Right
and
now,
stuff.
it's the state reimburses and the Medicaid reimbursement are a little bit different, but the state is paying $108 per day per adult. The Medicaid rate is a little bit less than that.
And then they deduct if you don't have a bed that's taken.
Yeah.
Well,
So,
you're-
Ms. Gadu, if I could get a word in, I have a question here. So your concern with having the beds always full is a funding issue, right?
it is because right now the only funding for detox in the state of Texas is the state of Texas, is the Health and Human Service Commission, other than private sources.
Okay. Mr. Rispe, in your proposal and your vision of the detox center, is there funding is coming from multiple sources in that
Well,
area, right?
when it was proposed back in 2013, everybody was at the table and talking about SCAN was there, and I think Webb County, I think Board Region, everybody, the city of Laredo was there. But what happened, and the reason it fizzled out was only because of change of administration with WestCare. And the person that was the lead person that took the lead for putting everybody at the table, moved on to something else. And so when I came to WestCare in 2016 of October, I was asked to put this back on the table, and to see if we could bring this back as an initiative. And so when I saw the invite from Dr. Gonzalez to my director, I asked if I could be in part of this committee, and that's how I got involved with this committee.
Do you remember where the money was gonna come from?
The money was gonna come from, well, this is a proposal. The proposal would included the Webb County, city, it counted also money from the hospitals, Laredo Medical Center, Doctors Hospital, any other medical provider that was here, because obviously, and then some monies.
And then they committed some.
There was monies that were there that were valid, and that's where that 1.7 came in. It was not all WestCare money. It came in from all those stakeholders. The only reason again it fizzled out was because of change of administration.
And they were gonna have this money every year.
Yes.
Oh, wow.
If I could ask Chief Torres, your officers couldn't take an intoxicated individual to a facility with full beds, could it? For detox purposes.
Well, it goes back to the protocols. It existed. Right now, what we're doing is taking people to the emergency room, the hospital ER for medical needs. If the person is highly intoxicated, whether drugs or alcohol, it goes to the hospital. And then we get what we call the medical clearance to continue with the criminal charges. And if not, they admit. That's basically what the only resource that law enforcement has for people that get picked up in intoxication. That are actually in intoxicated state. Our challenge would be, now that we have a directory, is how do we get to, I'm pretty sure that this city has enough people in need of services.
Yeah.
We do. We have realized that. Now, we have beds and we have services, programs, organizations that they say, and we've heard it before, we have empty beds. How do we get
I was here the full, that's why she had to be.
How do we get people in those, services? As, and optimize the services that we have existing right now as we move along with a new project.
Yeah, and just answer to your question, a lot of times intoxication doesn't mean that the person is gonna withdraw. So then I think we need to look also, that's, need to do a medical assessment to find out if this person is gonna go suffer from withdrawal symptoms, that is gonna need a specific type of treatment. Sometimes if I'm drunk and I recover from a hangover, and I don't need to really so it depends on how long the person has been using, what kind of substance they're using, things like that, yeah.
Yeah, we have people who stay at the ER for several days.
See, that's what I was kind of envisioning with detox, and I'm hoping that maybe y'all are in line with this. It just seems like we need a place to take these people instead of the emergency room. And we need to be able to, and the court needs to be able to take people that are gonna have to go off to a long-term facility and store them temporarily so they properly detox and can go off to those facilities. That's what I was kind of envisioning. So I guess what my proposal is that we talk to the old director of this other facility first. Then we hear, then the next meeting, we could hear West Care's proposal.
Okay.
So we can vet that for the,
And I can
for the
invite
future.
my director to be at that table.
And then, perhaps we could send out some kind of notice and invite any other, potential entities that could, that would want to be heard to do a comparable facility. But, yeah, I believe what I'm hearing from Scan, Mr. Flores and Ms. Dadu, sorry, Ms. Dadu, is that y'all have some treatment facilities for people that, it's sort of like a mix of a long-term and a short-term facility, much like Charlie's place. But would it be possible for y'all to try to think about a counter proposal for what West Care would be providing? Because that's what I'm interested in.
Sure.
I mean, it's disheartening, and I realize that that the state has some weird ways of funding programs, but it's disheartening to hear that y'all are required to have all your beds filled, because my concern is when Chief Torres brings somebody who is highly intoxicated, I want them to have a bed to go to, as opposed to filling up the space in our county jail.
Right.
I want, that's it. They have to have an empty bed. It seems counterintuitive to not
Well,
have an
then
empty
that
bed.
would be where communities, where city and county entities would have to come up with the money.
Right.
Yeah,
Is
yeah.
where it would, it falls on to pay on a cost reimbursement
Right.
basis versus on a unit rate.
Yeah.
But if Scan has a counter proposal, we'd love to hear about it.
Would love to.
And maybe we need to send out some kind of notice, I'm thinking, so that we can make sure we hear all the ideas.
Yeah.
I don't know how it can be accomplished, but that's what my proposal is that I'm sending forth to committee today, is to adopt those meetings. And then once we've heard from all those individuals, then we, I guess we set something up, maybe the second month after the election, or the first month after the election, maybe. the
Right
first
away,
month.
let's move.
Yeah, and let's get in here and what we can do is we can recommend what we've come up with at that time and set them all loose in the room, and we'll just lock the door and let them stay for a while.
Yes,
I
sir.
have a question, Chief. I know that Dr. Gonzalez went before the city council and they were gonna talk about a budget. Do we know what the budget is, or do we?
He's the one to report on that. That wasn't that council. I wasn't present during the presentation on the list, but
I was there,
Their
and they
report.
tabled it because Mr. San Miguel was late.
Oh,
okay.
And so then he said, go ahead and go home, was already 8 or 9.
oh, okay. So they tabled that.
But the priorities of this committee was already put in paper and delivered to every single councilman.
Yeah, because I understand that the reason that they went to this extent is because the state is allowing monies for opiates, and the issue of opiates.
Well, one of the things that they didn't put it into treatment, unfortunately.
Yeah.
They put a lot of prevention and intervention and recovery.
Right.
It's not in
It's
treatment.
not in
And the
treatment.
opiate money is exactly for that for opiate
Opiates
users.
only.
You cannot bring in somebody
Anything else?
detoxing from alcohol. What is for opiate,
only-
it's targeted money for opiates.
Only
And that's the way the
prevention.
federal government has restricted it. It cannot be used for,
Anything mixed.
you cannot mix.
Remember, our mission is not only, treat the ones that already are addicted, there's also prevention.
Sure.
Prevention.
Programs to prevent people to fall into the trap of abuse and.
Oh, that's
use.
good for the high school,
Prevention,
the
yeah.
school district.
That's what this committee talked about,
10-year-olds.
the school districts,
The school district.
the prong of treating people that already have the problem is not only capture them through the criminal justice system, but be proactive to the community to
Prevent.
respond and say, look, my son, my daughter, my uncle has a problem. Is there programs here? So the idea was to identify, and if there's empty beds out there, is to direct them to those programs
Yeah.
for assistance.
Well, SCAN has been very good about doing that project with the SCAN, Webb County SCAN Coalition. And, I mean, it's advocating, targeting youth and talking about, drug controlling the drugs and alcohol abuse in schools. And so I applaud them for that as well.
And that's a good idea, because, not only the committee, we, 3 meetings into assembling this committee, we talk about the statistics of how many people get arrested, how many people go to hospital, how many. Well, the idea is of every organization that has, stepped up to the table, says we do have a program of counseling and rehab.
Yeah.
Well, share that with the committee, because we need to share that with the city, that there is existing programs out there. The McGruff program with the police department that say no to drugs actually hits 47 schools every year. There's over 25,000 kids that get exposed to the police program to say no to drugs, and these are the consequences. Do we have an impact? And I'm pretty sure we do. But those stats are important to bring to the table. And, if their schools have their own programs already embedded in their own schools, we need to know what is being done. We already identified the organizations. We have any programs and what is the impact? Because otherwise, we're just gonna be spinning our wheels, because we do need a building, yes, we do. But we need to see how many people are being exposed to
Right.
a preventive, program, basically. Yes, ma'am.
I wanted to say one more thing, that's where I go back to the approach of the team. So I
Who are you
provide,
with?
Yvette Lopez
Oh,
with,
yes.
Medicare and Border. So I provide psychosocial rehab skills, to individuals with severe, mental illnesses, like bipolar, schizophrenia. I also do crisis on-call, in the rotation as well, so work in a hospital setting or a community setting like here. We go on a IMR, evidence-based book handbook, and, so that's the, IMR, that's the rehab that you're talking about, the rehab social skills, so Board Region does have it, and we have package 4, which is also like, 3 is like Baby Act, and then 4 is ACT, which is a sort of community treatment. And we do offer that, but we have small cases because of the intense treatment. And another thing is also, I just saw Dr. Rivera, which is the medical director, so she's also gonna be involved in trying to get a little bit more people. Jeffrey Jones, I don't know, he said he was gonna be here too. I think just with collaborating with, piece by piece, we come together as a community and build like a strong foundation,
That's what we need, collaboration.
Yeah, because most of the time it is dual diagnosis, because they're self-medicating.
I agree with you.
That, and then also like personality disorders too, and I think that's recommended like LCDCs, and then, a little bit of everything. Cause treatment and recovery is not only about like, medications, or it's also about like therapy, group therapy, and so, that's how you recover.
Right,
Yeah.
that's right.
Yes,
And we have to be optimistic and positive.
Yes.
I know this is a huge problem nationwide, and, but we need to be positive
Yeah.
and move forward, because we take that defeated attitude. It's one of those things that we need to, put a positive and
Yes,
attitude,
right.
And-
proactive, And the people that were impacted positively those are the most difficult statistics that we can actually show.
Right.
Well, there's programs out there, and I just described my agencies and schools and everywhere. There's other organizations that go out there. You see them in the paper and other mediums that they go out there to the public. And there's a health fairs, and there's all this coming up in our community. So people, are taking advantage of that.
Yeah, and I do see results, like with my clients, I do send them out to Charlie's Place. I send out two when they like one of them was a heroin addict for 15 years, he never received treatment. It took me about 3 months just to get them to Charlie's Place, I was just trying to keep them alive. And working with LCDCs and partnership with, West Border Region and having them counseling, and then the dad too was an X-ray support. That's what helped a lot. That helped out a lot, that the dad was like, we need to go, and also he had Hep C, so then we're talking about medical, so then, it was good progress, and I really didn't think about it much because I was like 3 months is not a lot, but it took me, weekly, face-to-face, hours and stuff.
Mr. Flores, Mrs. Dabu, let me ask you this. I mean, it seems like you've got all these programs and they have to have full beds, and you're looking for people to put in these places. Wouldn't it be helpful to have a type of a temporary holding tank for these people to go right before they go to your facility? Wouldn't that help you out? Because it would help fill those beds quicker, and they would have the treatment started, and they can have it perfected at these other places.
Yeah.
Is that what y'all are, would that be helpful to your?
No.
No,
Our holding tanks are.
not a holding, maybe a poor choice of words.
Well,
Well,
it's
it's
just
kind of
that,
flexible.
you have somebody like that, you need to have them assessed by a doctor and a nurse and find out, if that's the right place, and then we need to have the extra staff to deal with the intoxicated they're withdrawing, and it's a bunch of stuff with, the right medication that I need to have. It's not, just like setting up something and then do that.
And also, you have to realize that,
We're not, also not licensed, sorry, not
right,
licensed.
yes, for that, and treatment services, we do, inpatient treatment services, but for it to be more successful, we want the client to come in and want to be in treatment services. Yes, a lot of times after 24 hours or 48 hours, they do want to leave, and this is where the skills of our licensed professional counselors come in talking to them and, working with them to stay and give treatment and opportunity. And this is where the medical assisted therapy comes in to ease the withdrawal symptoms. So it's a process, but, we want the clients to come in and to get good quality services, but we don't want to hold anybody there against their will, because they're not going to get anything out of it. They're going to just buy their time, wait until, if they were told to be there 90 days, be there until the 90 days, and then go out. And they're not going to be successful. The most successful clients are the ones that during the process commit to the treatment and, graduate successfully from the program. We need a lot of beds for detox. I don't know, that's what I'm saying. We would need some numbers as to how many beds. Do we need 4 beds for detox, Do we need 5 beds for detox? What is the number that we would need in the community? And how many male beds and how many female beds,
I'd like
would we need?
Rudy, because I know he's Ozar, and I don't know if you want to talk about what you do for the community here.
Yes, I'm Rodolfo Price, and I'm with Tropical Texas Behavioral Health, Ozar. So Ozar is pretty much a state program that was created to pretty much provide the evaluations and connecting these individuals to their treatment services, all funded by the state. So we work together with these agencies, for example, SCAN and any other facility that we could actually set them in there. So we, for example, they get the evaluation and they are directly connected to the services. For example, for them to get into detox, / and then residential. So, and it's for both for youth and for the adults. So that's pretty much what the service that we provide. And right now, yes, there is a need with the detox, because right now, for example, they're taking, as opposed to for individual, your certain populations will meet the criteria for detox. So right now, they're, Charlie's Place is pretty much the designated entity that's DSHS funded in our region. They are taking, right now, it's pretty much 3 weeks before they can actually get in there. So there is not,
How many clients do you get that need detox on a monthly basis?
the majority of the individuals that I get are have an opiate substance use disorder. So you're talking at least, if I could, give a figure, could be anywhere between at least 15 clients
Per month?
per month. At
So
least.
so then,
We use their services,
So do we. That's why I know that there is sometimes a wait list,
Yes.
because it takes us a while to get them to detox. Then
Yeah.
it takes us a while to get them into rehab. We send them to detox, they come back,
Yeah.
there's not a residential bed available sometimes, and then they go back to using. So it's a cycle that
Big cycle.
never ends. So do we need the beds? We definitely need more
Yeah.
beds.
I was trapped, my daughter was trapped in that cycle.
Yeah.
Especially because right now, and I'll say it again, they're taking at least, when I get a client and they meet the criteria for detox, and you wanna get them in right away. And of course, state funded, they don't have to pay. So, I get them an admission date right then and there, should they, of course, want it and commit to it. And it's taking 3 weeks before they can actually get in. So what happens in that process, it's difficult because, we do connect them, for example, or we hope to connect them with SCAN for interim services. However, the majority don't end up following through because, what they're needed at that moment is a detox. So we
Right then and there.
have to work, we try to work together to keep them motivated, which is usually the hardest struggle for them to stay motivated. They come in that day, they want it right then and
Right
there.
then and there.
So a lot of them, do end up falling through the cracks, and end up just, and going MIA, or just, getting discouraged to commit to it, because they have to wait that 3-week period.
Right.
So we do a lot of, like, through the service that I do, I try to do a lot of the MI, which is motivational interviewing, to keep them motivated as often as possible. And, we do have a lot of success, so at least if we're able to get them into that detox, having that waited those 3 weeks, that's an accomplishment right there.
Right.
But the detox that you all are proposing right now and they're trying to get, is something that is desperately needed,
Right.
in my opinion.
Rodolfo,
Detox
let
and
me-
long-term.
My follow-up question, when you said success, and one of those discussions was handled a couple of meetings ago, how do we measure success? Because Judge Hale said that he's got a 75-80% of success rate in this drug court program, because the way he measures is people that went through the program, got clean, graduated, and don't come back to the criminal justice system, right? In a non-criminal program here like yours, is there anyone that goes and outreach and, check for relapse or a case like that where a person,
Well, I will tell you that after outpatient, just like SCAN, we have to do 60-day follow-ups. That's
Okay.
one of those
You do
things,
that.
after the 60-day, it's a little bit difficult, to follow through, but there's also like alumni support groups, that's one thing that we do encourage. Once they're done with the program, that they still have a place to come to, that way in case they do come into a situation where they may be going through a crisis, or at that point where they feel like using, at least they're there. And, so we try to keep that constant contact with them. Are we successful with them all? No. Their motivation changes sometimes from the beginning, wanting to stay clean, and then maybe at the end something happens and it doesn't correct. So it's a lifelong,
Just how their motivation changes in the 3-week waiting period, that they can be motivated at that time to detox and then.
But I think the most frustrating thing is when they do show up, thinking, okay, I'm gonna go in, and having to explain to the families, because we're really honest with the families at the get-go that it may not happen today, and more than likely, it's not gonna happen today. So just keep coming every week until hopefully, we can get that bed for you. So we work very closely with Rudy, we work very closely with the QMHPs in all of the sections there at Border Region with Charlie's Place with SCAN, because that's what's needed. If not, like you said, they do fall through the cracks. But we do need more. We can't, I've been in the field since 2002, and I think, and I get frustrated because we are still talking about the
Spinning our wheels.
same frustrations. Since 2002, I mean, I haven't been in it for very long.
Same
but-
individuals.
Yeah, and so it's a cycle that it hasn't changed.
Well, and that's what I, you know, when I hear somebody say it's gotta be their choice, and I think that's where you say we've gotta change laws. So now we've gone bigger than us here, we're talking about laws now. Because it's a fairy tale when you think, oh, it's gotta be their choice. Well, it's a lovely fairy tale, but they're addicts. It's a fairy tale. An addict, if you really truly know what you're doing, an addict is an addict. And it's wishful thinking and it's beautiful thinking, but if they're not locked down, if they're like my daughter, a hardcore case like my daughter, locked down or nothing.
Well, then we have to fight the ACLU.
Yeah, because the other thing is, my other friends, I have some other lady that she said had she not gone to jail, she would not have recovered.
And I have
Why does
something-
she have to go and recover in jail for a year or whatever, or 2 years that she has to go to jail and leave her children? Instead of treating them like criminals, we're supposed to be treating them like human beings that are addicted. They have a disease like cancer, but they can't choose to cure it. Like, you know, you can cure cancer, but some people don't wanna go get cured from cancer and they don't go, so that's. But now when you didn't have mental illness, now you do have mental illness. If you didn't, you know, so.
In my strange way of connecting things, I think the way we can get help from the state and laws and everybody else who's involved is connected to all those horrible mass shootings.
Yeah.
That it's affecting.
Mental illness,
Yes, and they will listen to that.
stigma, it's too stigmatized.
And they will listen to that. We're gonna have to connect it. It's horrible to say that. But unless we get people scared of, oh, I don't want that happening in my town,
Let's just do something.
we need all the help we can get, and we need to involve Richard Raymond and Henry Webb, our representative and senator.
Because we're not targeting the mind, we're just targeting the symptom.
So I want to say the way it works like with Medicaid or when you do with Betty, so it's pretty much gonna be based on like on the approach. So for example, like I go back again to the IMR, like my role is to prevent psychiatric hospitalization, homelessness, and incarcerations. So, and it has to be like evidence-based, like what are the statistics like you guys are asking right now? And it has to be studied, and what are the control, and then to other details.
Yes, we need to get our
So it's
statistics
based
together.
on
Get the facts.
approach, the type of approach that we wanna use, cause there's so many out there.
Like in the year, how many resulted in total remission?
We need to, we need statistics.
In the last 7 years, of all the clients you saw, let's say you saw 200 clients, of those 200 clients, how many came back clean?
Oh,
How many you know?
Yeah, well, everybody.
Everybody.
And also, I think we need the amount of money the hospitals are losing.
Yeah.
Law enforcement and transportation,
That was the initial thing when
the
when
EMS,
they were,
all of those.
they were talking about,
Yes,
if you include hospitals, they lose millions
yes,
and
because there,
millions.
you have
And
to
if they
take the
invest-
patient.
If they invest 1.5 million into a project to help individuals who are gonna end up there in their place in emergency anyway,
They may
then
not be treated like, my
Then you
daughter was
save money
treated because she had
in the
insurance.
long run.
Her friend was not.
So that's why they were included at the initial.
I thought they couldn't.
What is, what goals are
I don't know what happened, but she ended up dying.
Sorry.
Yeah. Okay, well,
Sepsis.
it's, time to adjourn.
Before we adjourn, Madam Chair, let's just recap on what is the next meeting objectives. So,
We've got 4 from Mr.
Uh,
Thompson.
Thompson, you have those, did you pencil those in?
Well, I kinda just, was hoping someone else was the note taker. I've got them scribbled, but I'm not sure if I my scribble.
I've got
But
4.
Let me ask, Mr. Reesfay this though, because you're the one that, we're focused on right now, because you're the one that we know has a proposal. We will hear other proposals as they come forward.
Yeah.
But, would it be helpful for you to, for us to interview someone from the county first regarding that potential facility, or would it be more beneficial for you to lay out your plan and then we talk to the county about what facility they have? What would be?
Well, I mean,
I don't put the cart before the
I've heard
horse.
different, I've heard different proposals, like for example, I heard one meeting I went to where the sheriff was there, Sheriff Cuellar, and he talked about a facility that he might be able to offer. I've heard about the other place that y'all were talking about. I actually have also approached the place where we have our program participants, which are 20 homeless individuals, about using that facility for the 20 beds. Of course, we're staying there till October 2019 because of the fact that our grant is going to end by 2019, and then our monies were reallocated because of other issues that the HUD put on our program. And so right now, there's people that we submitted an application. There's only one agency that's on the table that might be considered for our program to continue. But as far as staying at that facility for the homeless individuals that we have there, it's not prone to Housing First, which is the HUD guidelines. So Housing First, it's a real complex issue, but they believe in housing individuals in scattered housing rather than in a complex like we have, because we have it's basically a dormitory where we have people and they share showers and they share a kitchen. So Housing First tells you that you have to have a place where you have your own shower, your own cooking space, and privacy. And so that would be the way it's supposed to be. So if and when our program ends, which it will in October 2019, and no one else takes it over, which right now there's a lot of legalities with the application that was submitted by the entity that submitted that application and through Texas Homeless Network, that there's a possibility that facility might be available. Okay, I already talked to them. This is Catholic Charities. It's owned by Catholic Charities or the Diocese of Laredo. And that facility has been there since back in the 80s. And it was a Frontera home. It was a place for alcohol addiction.
It was a halfway house.
Halfway house. And so, I mean, it's known for having individuals of those problems. So they were open to that concept. I'm sure if I was to approach them, they would be open to that concept because of the fact that we're going to be moving from that facility, or we're going to be losing that money. That program is going to end. So I could bring them to the table for the next meeting if y'all are interested in hearing what they have to put on the table. And you don't need money for it. It's basically turnkey operation. But again, you know, the monies that request there is not easy. It's not it's not cheap. Let's just put it that way. The rent there is quite extensive rent.
The diocese rent.
Yeah. It's about $11,500 per month.
Well, given the nature of the housing and the fact that we may not be even talking to, I mean, most likely we are, but probably we may not be talking to, we may not know who to talk to with the housing. I would recommend for October that we hear from the old director of the old detox center, Jesse Hernandez, and we invite him to the October meeting. So the November meeting, I would recommend that we hear from West Care to hear the proposal.
November, okay.
In December, I would like to hear from any other would-be proposals. And then perhaps in January, we need to talk about a roundtable lock-in or what have you for that would be my proposal, and I'm putting out there for a vote to see if that's what y'all want for your agenda for the next, 1, 2, 3, 4 months.
Sounds good.
Do I have a second?
Sounds good to me. Second.
All right, all those in favor, say aye.
Aye.
Or aye, raise your hand. All those opposed?
Motion
Okay.
passed.
Oh, and one more thing, and I wanted just to caveat, on that listing of those providers, I don't know if y'all noticed, but none of them had that they accept Medicaid or Medicare. None. I had none of them
I was
on the
reading.
listing.
I was reading.
None of them. And some are just private insurance and some are, financing's not available. So it's tough. It's
Yeah,
tough. If
It is
you,
very expensive.
if you have those issues, it's tough.
Right, you.
It's tough.
So then if a police officer picks up somebody and tries to take them to the hospital, they can be turned down because they don't have insurance?
No, the ER doesn't turn them out, and of course, the police department, the only time that we pick up people is because they've been charged with a crime, or they committed a crime, they're suspected of that, so we're responsible for that. If the hospital says this is a medical issue, then we just, the hospital will either have to detox them and admit them somehow or another.
So,
There was a time that I do remember, they were just turning away, homeless
Yes.
at the ER. There was a time, but not, I haven't heard.
not anymore.
I have not so far.
How long have I been-
There are some cases, but it's not a, 100%, hospitals right now, they're having an issue with the mental population and everything else. They are having the last item, to discuss, and just very briefly, there is the commissioners here that are appointed by the councilman. There's 3 vacancies. And I'm gonna open it to anybody here that is present, if you have any idea or suggestions, nominations. Anybody that'd like to serve in this Drug and Alcohol Commission, send the name up to us, contact number, so we can vet them. Suggest that to a councilman that has not submitted a name, so we can have a full roster for commissioners. I have 4 names here on my desk, but nonetheless, Dr. Gonzalez and I will be reaching out to them. If there's anybody who wants to volunteer, pass the word out there and, submit it to,
Which is the councilman that has the vacancy?
top of my head, I don't know. There's 3
They
councilmen.
send that email, alright.
Regardless of the names, there's 3 vacancies, so we need to do that, because, this commission is, it's a citywide, and of course, we need every councilman represented in this commission. After that, Madam Chair, if you'd like to adjourn, I don't have anything else. Unless there's any comments from any other commissioners present.
Oh, real quick, who's going to invite Jesse Hernandez?
I was supposed to contact him, but I don't have I haven't seen Dr. Gonzalez to get the information to find
I
him.
can reach out to him and let him
Okay.
know about the request.
Please,
You do that?
I have
and to
your
bring
phone
the
number,
info
too.
with him about how he ran and what he did and with you
Well, Manny,
guys.
let us know if there's.
Of course, and I'm sure
I
he'll-
guess he needs permission from you guys.
I'm sure. Again, I still think SCAN would probably be the best entity to spearhead that, but, I can still reach out to Mr.
Okay, go to Jesse and tell him he needs to talk to Ms. Abdu, and she sent
She's the
you.
one who sent the proposal. And then-
Okay, then we meet Ms.
and we
Abdu
hired
and not
and
Jesse.
then-
To be frank with you, that would be the best option.
Yeah, basically, the commission just needs to pick his brain to how.
Well,
we
again, he can
develop
certainly be a part of the
program like that
conversation.
and push it out there.
Yeah.
Right, but they have the blueprint.
You got it.
Yes, right.
Well, Mr. Flores, would you assist our chairwoman in inviting Jesse Hernandez to our
Sure,
next
I'll give
meeting?
him a call.
And Ms. Abdu, both,
Ms. Abdu?
because she's the boss.
Yes, she is.
So we're in a roll.
And when are you admitting, any other proposals, is in November?
December.
I'm thinking December, that would be a good time to
Okay.
submit any counter proposals. For a detox center specifically, just so we can have,
Are you
it
looking
seems-
for male and female or just male? We
What-
haven't been privy to this.
What I'm envisioning here is a facility that we can take people, first people that are just, the police department finds that are highly intoxicated or or addicted or the like, and they need to take them somewhere, better that facility where they can have some type of nurse or what have you than the prison, or the jail. And then second, maybe, I was even thinking, it would be nice if it could be maybe a pseudo facility, I guess. Have some people that are there because, you know, they were caught and they need to be there. And the next place where they go when they detox is the jail for a little bit. And others where maybe they can pay in and get a bed and just have a family member drive them over and detox right there. That's what I'm kind of envisioning. I'm not sure what the proposals will go toward, but anything is better than nothing right now, you know. So we just need to hear from these proposals.
Sure.
But that would be ideal.
We also entertained the idea of the police department compiling a short list of our known drug users that are also habitual criminals, that are not in jail, that are not waiting for court, and have a program go out there and knock and talk and offer what they have. You want solutions, you need counseling, here we are, volunteer basis, but an outreach program versus waiting till they get a handcuffs placed on. That's something we entertain.
Anything can be done if there's funding available.
That's,
Of course.
That's right. We just
You
need
can
to
design anything if
be
there's enough
proactive
funding.
about it.
Yeah.
Madam Chair, it's all yours.
okay. Thank you, and thank you for all of this information. We really appreciate it. Thank you for coming. We want to see you all back.
We will be.
And the meeting is